I'm Jacques Branch, and I'm a practicing family and emergency physician here in Alberta. And I'm also the Chief Medical Officer of Coalese Health Systems. So what is Coalese Health Systems? Well, it provides value-add tools to our existing electronic medical records in primary care to get more innovation out of those products, to get more delivery of healthcare that's quality to our patients. So humor me for a minute and just close your eyes for 1 second. Now, last time you or your family you were with your family doctor or your family was, what did you leave with after that appointment? Maybe it was a requisition for some investigations, maybe it was a prescription, hopefully legible. Now open your eyes for a moment. What I want to do and what Coalese is doing is putting into the hands of individual Albertans and Canadians automated on-demand care plans. No, not just care plans that sort of say, here's where you are currently, but we take a look at every chronic disease you have, apply it to the best practices that physicians and nurse practitioners in Alberta and Canada are following to make sure that we generate the right action plans for you. Now, your physician and you can then collaborate on that to decide which of those actions you want to follow, but it's there. We also look at, as an individual patient for your care plan, every single preventative measure that you qualify for, all the cancer screenings, vaccinations, to make sure that you have the option that you're not missing those things that could really help you down the road. We also know that there's benefits to the system if we're catching those on a regular basis. So, as Alice would ask me, why did Coalese go into this? Because we're actually an integration company initially. We pivoted because we saw a huge market. Because with those care plans, not only is it really valuable to individual patients and physicians, but the physicians are being reimbursed to produce those care plans. And it makes about a market for Coalese about $10 to $14 million recurring annually to be able to provide this type of service. So not only are we altruistically improving patient care, assisting our physicians, but there's a market here that's needed. This program where the government's been paying for this has been existing for over 8 years with a terribly low uptake because there's been no tools to be able to effectively accomplish this in the marketplace. Coalese is changing that. As Brad would ask, we're great on the product here and we're focused on it. It's a really good one. Do we have the right team and have we focused on the business aspect? We have a team of experts that have been there before and gone through multiple acquisitions and selling of companies. We have a diverse board that, again, can lead us to make good business decisions to support this so that we can scale this out across Alberta and across Canada and broader than that. Next time you open your eyes, I'm hoping that you're holding a comprehensive care plan, one that enables you to collaboratively work with your family physician going forward.
Which markets are incentivized by doctors in preventative care and care plans for their patients?
Absolutely. So specifically, with regards to this payment that Coalese has pivoted into to try to capture, it's in pretty much all the provinces. In Alberta, it's specifically, there's a code that physicians would bill as soon as they print this off and they give a copy to their patient. And so that billing then comes back as a revenue to the physician within 2 weeks of doing this. So it's a very fast turnaround, which is important from a business perspective for Coalese. Additionally, I was just out in Toronto speaking with physicians and with other entities out there, and there's a very similar incentive program. BC is the same way, Quebec as well. Quebec will be a bit of a challenge from the language side, but otherwise, the markets are there across the board. And if you think of what we're doing with the product, which is putting a care plan in patients' hands, it doesn't matter what jurisdiction you come from, there's value in that. There's value in that collaboration. So whether it's Canada, the States, Europe, abroad, the value is there. How the physicians are incentivized can be quite different across those jurisdictions, but in Alberta and in Canada, they're very well defined.
As per our discussion this morning, as you know, I would love to have a care plan in my hand, but will I get a dialogue with my physician?
I'm sorry?
Will I get a dialogue with my physician?
Oh, absolutely. So that's really important. So what you're bringing up is the question of, does this replace patient and physician collaboration? The answer is absolutely not. It engages the patient and it gives them the empowerment that they need to be able to do really well and to collaborate properly. So again, in Alberta, The physicians are actually paid separately than this for the actual encounter. So this doesn't take away from that at all. This is purely in addition to it.
Okay, one quick question. Time's off.
Census from last month, 22% of Canadians are non-Canadian born. Is your marketing plan include multiple visuals and multiple languages?
At this point, the market is significant for us in Alberta and the immediate jurisdictions that we're looking at, that I don't think Coalese will be in existence long enough. It'll be acquired. We are a company that acts as an add-on to electronic medical records, and this technology would be something that would be acquired by another entity.
Thank you very much.